Hello, everyone. Today we're going to talk about how the population size and medical expenditure influence the growth rate of cases of getting infected by coronavirus in China. I'm Xiangyu, and we also have Xinjin and Wyatt Prince. So for some background information, the first case was found on December 2019 in Wuhan, China. Scientists have found that it was transported from wild animals to humans, and it has a dormant period of up to 14 days and causes initial symptoms similar to the influenza. It could also cause inflammation of the lungs that could lead to death. So far, there's no vaccine was published to cure it. So for some literature review, the R0 of coronavirus is about 2.5, and as you can see on the chart on the graph, the influenza has a R0 of 1.5, and the R0 which is greatest for measles has like more than 10. So R0 is a factor that measures the average number of people who catch the virus from a single infected person. So if R0 is 2, it means 2 people could get infected from a single case. If R0 is less than 1, for example the MERS, the virus would be less likely to transfer to another person and would easily vanish. But if it is more than just 1, it is the greater the R0, the greater possibility for people to get infected from in a large population. Since current fatality ratio of 2.4% is not so high, it caused some government to neglect it, and it has made some situation more serious. Also, since most offline stores have to close down to avoid large gathering, there will be a economy slowdown in the foreseeable future in 2020. And there's also some knowledge that we need to know that currently there's a scarcity in medical appliance, and ventilator is a machine that is mandatory for some severe cases for those people to stay alive. And at the moment, unfortunately, US has the largest number of confirmed cases in the world.
Hi, this is Xinjin, and I will show you the methodology in our project. And in this part, there are three mainly topics, which are variable selection, data collection, and the data process in three main types of the relationship graphs. Okay, so let me show you the first part, which is the variable selection. As you can see in our project, we choose the population size, medical expenditure, and the growth rate of infection as the three key variables. And then I will talk about the reason why we choose the three. First, for the population size, it it actually represents the number of the citizens in each province. And actually, in the earlier stage of the project, we discuss about the population size and versus the population density. However, finally, we choose the population size as a variable. The reason is that, like in China, the urbanization is highly mature, which will cause the most population to gather in the city rather than the countryside. However, since COVID-19 is a respiratory disease, the cross-infection will much more likely happen in high-density area, actually in the city. Therefore, we choose the population size because it might be a much better parameter influencing the growth rate of the infection case. And second, for the medical expenditure, somehow it represents the local health care's quality and resources. And since we like investigate the Chinese situation between the Fab 3rd to Fab 12th, there is in that time China like didn't have a pretty professional technology to detect all of the potential patients. So the Chinese government decreased the potential of the cross infection by isolating all the people who may have the disease. And as a result, and by the way, there is no specific medicine or vaccine for COVID-19 even nowadays. So our group think the medical expenditure might influence the growth rate of the infection as well. Last but not the least, the growth rate of the infection. It actually represents the increasing speed of the case infected by coronavirus in China, which will directly show the spread of coronavirus and be easy to compare with each other province. The next part is about the data collection. In this project, we mainly retrieve the data from three sources. First, for the population size data, we retrieve them from an article called Chinese Province by Population in the World Atlas website, which is a pretty professional data website. And second, the number of the new infection case data from February 1st to the February 12th. We got this data from the World Health Organization website, which is WHO website, and you can find them in the coronavirus disease situation report in this website, and we also provide the link in the references page. And for the medical expenditure data, we retrieve them from the national data website, which is actually a Chinese website providing the data in the national level. And as a result, this website is also professional, scientific. So, okay, so let me show you the third part, data process in the three relationship graphs. And as you can see, in our project, we use the Microsoft Excel to process the data and visualize them. And since the data we retrieve from the WHO website is the infection case, but we need the growth rate. As a result, we use Microsoft Excel to calculate the growth rate for each day, for each province. And then we calculate the mean growth rate for each province. And we also calculate the standard deviation as well. And then we use the main growth rate and the data about the population size and the medical expenditure to draw the graphs. And through the graphs, we will try to explore the relationship between the three key values. And actually, we try to guess there are three main type of the graphs, which are positive correlation, negative correlation, and no correlation. In our project, positive correlation means the more the population size or medical expenditure is, the higher the growth rate of the coronavirus, COVID-19 infection is. Negative correlation represents the more the population size or the medical expenditure is, the lower the growth rate of the COVID-19 infection is. And the no correlation means the population size or medical expenditure will not influence the growth rate of COVID-19 infection at all.
So now let's see some figures. So for figure 1, as you can see, there's a downward trend on the total growth rate as the time goes, since the data we got is 2 months After the first cases in December, it means that China is having things in control, and we expect the growth rate going down further in the near future. Similarly, this graph has also shown a downward trend, which means on average there was not a proliferation in most provinces, and China has passed the hardest time in control the virus. For this graph, we wanted to find out whether Chinese government has gave sufficient medical resources proportion to the needs of each province. As we see, there's a strong positive correlation between the population and the medical expenses. So, which means that at normal period, Chinese citizens has fairly received the medical service that they need.
Okay, so this is Xinjing. Let me show you the figure 4 about the correlation between the medical expenditure and the growth rate. Um, Unfortunately, after drawing the graph about this relationship, we find that the mode is no relation between the medical expenditure and the growth rate. And actually, these two obvious points could prove that. There is an obvious point in the right of the graph, which is actually the data from Taiwan. Actually, Taiwan puts lots of money on the medical expenditure and infrastructure. However, their main growth rate is just slightly lower than the average mean growth rate. So it improves. There's no correlation, and there's also a obvious point in the end of the in the graph. It is actually the Xizang's data. It puts few money on the medical expenditure, but actually, from February 3rd to February 12th, there is just no infection case in that area. So let me show you the figure 5 about the correlation between the population and the main growth rate. And again, there is no obvious correlation between these two variables. After discussion in our group, we guess the reason is the Chinese government pretty focused on this disease because of its severe spreading ability, and the local government also employ the strict rules about the quarantine and lockdown, and China's citizens just also obey the rule actively, and take my family as an example. My mother and the younger sister actually stay at home for more than 60 days. And we guess that's a reason why the population doesn't influence the main growth rate of COVID-19 pretty obviously. Okay, the last figure is about the correlation between medical expenditure per person and the main growth rate. Actually, we discussed the relationship between total medical expenditure and growth rate in figure 4. However, the outcome is no relationship. Therefore, we divided the total medical expenditure by population size, and then use it and try to figure out the correlation between the medical expenditure per person and with the main growth rate. Unfortunately, like the mode is also the no correlation. After discussion, we guess the reason is that due to the lockdown of Wuhan in early stage, there is few infection cases spreading in other provinces in China. As a result, there is no medical wrong situation happened in other provinces. By the way, medical run means most of people go to hospitals to squeeze and waste medical resources. Since medical run did not happen in other provinces, local medical resources in these provinces are enough for them to isolating all of the potential patients. Therefore, there's no obvious correlation between medical expenditure and the mean growth rate.
Hi, this is Wyatt, and I'm going to talk about the last few slides of our presentation. So from these figures, we were able to have many conclusions. However, it should be noted that there's a 14-day incubation period for the virus, along with very limited testing for the virus. So these reported number of cases are more likely to be underreported, as is the case around the globe. Additionally, on April 1st, many countries believe China purposely underreported cases to downplay the virus. So that's another reason to believe that the case numbers were underreported. However, from our data, we can conclude from figure 1 and 2 that the mean growth rate of the disease disappeared to taper off after a peak increase in infections has occurred. From figure 3, we conclude China has a strong positive correlation between province population and medical expenditure per province. From figure 4, we conclude no correlation between a province's medical expense and the virus's growth rate. From figure 6, we conclude that there is no correlation between a province's medical expense per person and the virus's growth rate. And then from figure 5, we conclude no correlation between a province's population and growth rate. From our conclusions and literary review, which we kept reviewing the entire part of the project due to the novelty of this data and issue, we recommend the following. All unnecessary large gatherings and transportation must be prohibited to lower the spread of the virus. Clear and concise messaging from government and health officials in all aspects of the virus, such as case and death numbers, what to do when sick, how to quarantine oneself, etc., is essential. Finally, as we have seen with the different provinces of China, no matter the amount of money spent towards healthcare and the amount of healthcare supplies on hand in hospitals will not be sufficient to stop the overrunning of hospitals due to the influx of coronavirus patients, along with normal hospital numbers of people getting injured and being sick. Thus, flattening the infected curve via social distancing is paramount. Social distancing is key to saving lives and stopping this virus. Finally, here is our works cited. Thank you for watching, and we hope you learned something from this project. Have a good rest of your day and stay safe and healthy.